The role as a surgical case coordinator is to make the process easier on families. We're there for a one-stop shop. Any questions you have throughout the process, we're there to guide you. If we don't have the answer, we'll help you get the answers. We're really your person throughout the process, and we're happy to help in any way we can.
The role of a cardiologist, I see it as threefold. The first thing that a cardiologist should do is to be an educator to parents and families. I think that the education is so important in terms of helping families understand what the heart condition is and what needs to be done in terms of achieving a biventricular repair. Because the heart is so complicated and there can be oftentimes many different things to address, families don't have a really full understanding of what the heart condition entails and what needs to be done. So we often will actually use some of the 3D models and some of the imaging tests to help explain what is going on inside the child's heart. So the second thing that a cardiologist helps with is to both direct the care of the child as well as to advocate for their needs throughout their hospitalization. So really the cardiologist is involved in every step of their care, from prior to arriving to Boston Children's Hospital, as well as throughout their stay and even after they've left the hospital. The cardiologist will review the information prior to arriving and help educate the families, as well as help determine what testing needs to be done when they arrive at Boston Children's Hospital. The cardiologist then will meet with the family and the patient prior to all of their testing at Boston Children's, and then follow them throughout their entire hospital course. The cardiologist is also involved in the care once the child has left the hospital in terms of communicating with outside cardiologists and helping with follow-up.
My role as a surgeon is to really think about how I'm going to get the valves, the ventricles, situated in such a way that we achieve a biventricular or 1.5 ventricle repair. This may require several procedures, and I have to think about how the valves work, what's the best way to get the ventricles to the right place, and how do we do this in a safe fashion.
For patients who are not local to Boston Children's Hospital, I want to stress the importance of having a local cardiology team and a local cardiologist. We often will work very closely with local cardiologists prior to patients coming to Boston Children's Hospital to understand what kinds of testing are necessary, as well as the timing of their visit and operation. Following discharge from the hospital, once patients go back home, it is again really important to have that local cardiology team to take care of the child. And we tend to work very closely with these cardiologists to help determine what kind of follow-up testing is necessary. Most patients with complex biventricular repairs require long-term cardiology care. And so the follow-up really does depend specifically on what the heart condition was and what was required to treat that heart condition. So it really does depend on what that child has. That being said, most children do require follow-up appointments with their cardiologists. Many children do require specific medications to treat various aspects of their heart condition, as well as follow-up echocardiograms and other testing. In some cases, children will need follow-up surgeries to either repair valves or address some other issues. For example, if somebody has a pulmonary valve that's replaced as a young child, as they grow, sometimes that pulmonary valve does not grow with their body, and sometimes they need to have something like that replaced. And so in the future, following a biventricular repair, there are a number of children who do require follow-up interventions as well.